Hello and welcome to another great episode of It's All Interventional. Today, we're going to meet with Jason Worthington. Now, Jason has had a history of being a staff nurse as well as a manager of a very busy Cath Lab department in Georgia. Now, he's recently transitioned to being a travel nurse. So today, we're going to talk to Jason about his perspective of the pros and cons of both full-time facility work as well as travel nursing. I know a lot of folks have been doing a lot of traveling around the world, around the country, and you might have some other perspectives as well. So maybe we can have a meeting with you sometime in the future. Just leave a comment down below. So please stick around. We're going to talk with Jason Worthington. All right, Jason, thanks for joining us today. Now, you've been a staff nurse and a manager in a Cath Lab for several years. How many years have you been in the Cath Lab and working as a nurse?
I've been in the Cath Lab almost 14 years. I've been a nurse for 25 years.
Okay. Now, you have just recently transitioned to travel nursing, correct?
That's correct. It's been about a year and a half now.
All right, fantastic. What would you say is the biggest positive of working full-time in a facility hospital in the Cath Lab?
Well, everybody likes their routine. Everybody likes certainty in their life. They like to know what they're going to get up and go to every day. When you work at a hospital full-time, typically you live in that area. You know the area well. You have friends and family nearby. Which is totally different when you're traveling and you're going into an unknown situation or area.
Sure. Okay, that makes sense. Okay, so now that you've been traveling for a little over a year now, what would you say was your biggest concern when you're thinking about joining the travel program?
Well, I think the biggest concern was just the consistent income. You really don't know what you're going into. It's easy when you talk about it with your recruiter and you hear from other people, but it's very different when you actually make the move, give up the full-time status, go somewhere totally new, and you just want to make sure that when you're supporting a family and you've got a mortgage and car payments, that income is coming in.
Gotcha. That makes a lot of sense. Is this still a concern for you?
Well, actually, no. Once you get into the traveling, you kind of get into the routine of traveling and you start to understand it more, then no, you realize right away that the money's good, the income is consistent. It doesn't change at all. It's kind of up to you. I mean, it's usually understood that when you go into a travel assignment, your hours are guaranteed. But that's not always necessarily true. I mean, it's totally up to you. If you want to take days off and whatnot, you can do that. You just have to keep in mind that when you take days off or go home early or whatever, that you're just not getting paid for that.
Okay. All right. What do you like best about the new journey of travel nursing?
I like to learn. I like new experiences. I'm not afraid to take a risk. So when you go to a new facility, a new procedure lab, whatever, there's always that period of time where you learn something new. You work with new doctors, you work with different staff, and a lot of times you do procedures that you haven't done before. And that's the part that I really enjoy the most, is just learning something new.
All right. What would you say is the biggest drawback from travel nursing?
For me, the biggest drawback is just being gone, just being away from your home and away from your family. It's hard sometimes to be gone for 2 or 3 weeks at a time. Most of the assignments I've had have been pretty good about having the weekend off, or obviously working in the Cath Lab, there is some call requirements depending on where you work. And that might keep me gone from home for 2 or 3 weeks at a time if I'm on call, 1 or 2 weekends in a row. So for me, that's usually the hardest part, just being away from home.
So most assignments are what, about 13 weeks?
Yeah, assignments can range from 2 weeks to 13 weeks. That's exactly right. Most of the assignments I've taken, I've had very few that were 8 weeks in length, and most of them are 13 weeks in length. Yes.
Okay. So you're talking about being far from home. How far away do you travel? How far away could you travel from home with these assignments?
Well, currently, the farthest that I've gone is about 2.5 hours, which was just on the other side of Atlanta, really. Currently, I'm with traffic about an hour and a half, hour and 40 minutes from home. I mean, if I really wanted to, the company that I work for is an international company, so I could probably go to Europe if I wanted
Oh,
to.
wow.
Yeah, that would be a stretch for me, but I mean, honestly, anything's possible these days.
Wow. That's kind of exciting.
Yeah.
All right. So let's pretend that I'm a staff tech or a staff nurse at a hospital. Been working there for 5 or 10 years. I'm getting a little anxious. I've been hearing about some travel work. I'm wondering, what can I do about that? What would be some advice you can give me when I'm thinking about doing some travel work?
Honestly, the best advice I give people is, make sure that this is something that you're ready for. And make sure that you're ready to leave your situation, go somewhere totally new. But not only that, just make sure that you are actually comfortable, competent in your job. That you're willing to step into a lab and really just put your reputation on the line. These hospitals, they give you a little bit of an orientation most of the time, but they expect you to come in and within a day or two, basically to be working on your own. So just make sure that that's something that you really feel confident in your skill set, that you can go in. And like I said, it's your reputation, it's your company's reputation that's at stake there. So make sure you're ready for something. That's a big step.
Yeah. Okay. That makes a lot of sense. So probably not a step if I'm a brand new graduate from a program, but after I've been established in the department for a while.
Yeah, I would not recommend it for a brand new graduate. Typically in a highly specialized procedural area like the Cath Lab, a travel company is not going to place you in a position like that. And honestly, the hospital itself is probably not going to accept you without some really good experience.
Okay, that makes some sense. So let me ask you a question, bounce off that one. Have you worked with several other travelers in your journey?
I have worked with RNs and techs, and I've seen a little bit of both. I've seen people that have stepped into the travel role, and it wasn't at all what they thought. And I've seen some techs, especially, that were uncomfortable and really took a little more. I guess a little more orientation than they expected. Of course, the hospital doesn't like that because they need the help, and that's why they hired you in the first place. Yeah.
Right. They're looking for experience on day one, not there to train somebody as a traveler.
Correct.
That makes a lot of sense. All right. A couple more questions for you. What advice would you give to a hosting facility when they're trying to bring on some travelers?
One of the biggest headaches that I've run into is usually the onboarding process. It's always different in every hospital you go to. Some it's quick and easy, and some it's like a 2-day. I really wish there was a way that hospitals could sort of make the process universal so that you only have to really go in as a travel nurse and just learn what's pertinent to your job as a travel nurse. And honestly, there's been a few occasions when I've had a phone interview with a manager and they haven't really kind of explained the job accurately, I would say. I would like to see the managers or coordinators, whatever, in these facilities be a little more honest, I think, about what you're actually stepping into. I think that would be I think a lot of travel nurses would really appreciate that.
That makes a lot of sense. Now, let me ask you this related to that. Is that something, do you think the travel agencies could get involved with to make that more streamlined, or do you think it's got to be more of the facility level? And again, that was just your opinion, just me talking out loud with you.
I think it's more on the facility level. A lot of hospitals, there are hospitals out there that are Joint Commission accredited and a lot that aren't. And I understand that a lot of hospitals kind of get their orientation models from Joint Commission. There are things that are required, information that they are required to convey to employees. I understand all of that, being a manager in the past, but I just wish that for travel nursing, maybe there was a way that they could sort of have a universal set of information that was just more or less specific to travel nursing. Yeah,
sure, makes a lot of sense. Okay, thank you. All right, one last question here. What can you as a traveler do for the hosting facility to make the experience more successful for both of you?
I think, like I said earlier, make sure that you are actually, as the nurse, prepared to step into a situation, so that make sure you're actually competent in working. I think another thing that's really important as a travel nurse is you want to go into a situation and you want to do your best. And also, I've worked with other travel nurses who were clearly just in it for the money, and that's fine. The money's there, but at the end of the day, I think the best advice that I would give people is you want to go into a situation and you want to do your best. You want the facility to know that they hired somebody that's going to work hard for them. And like I said, it's your reputation on the line. It's your company's reputation that's on the line. But at the end of the day, you want to go into a situation and give the best possible patient care that you can, because really, at the end of the day, you're there to help, and you're there to help the patients. And you don't want to go into a situation and just be, for lack of a better word, just lazy. When you want to go in and be a hard worker. And I think in the end, that helps you, to build your reputation. Because, really, it's kind of a small world out there. You'd be surprised at how many people have heard your name before once you get into the business. And, you're a bad work ethic can follow you for a long time.
Can haunt you for a while. That makes a lot of sense.
Right.
All right, Jason, I can't thank you enough for your time and your experience. Your words of wisdom have been fantastic. Really appreciate it. And so for those of you who are thinking about traveling, if you're thinking about traveling, it's a great perspective here. Talk to those around your area who've been traveling. Call your recruiters in the area to see if they have any traveling openings, just to get more information. But, if you are a traveler and you're watching this, you have other information, leave a comment down below. I look forward to talking to other folks, get more ideas, more perspectives, more thoughts on travel nursing, travel tech work, different areas. We have some that'll go to big city hospitals, other rural hospitals. There's so much variety out there. I know that, in the last several years, the whole paradigm of working in the facility has changed, where, it used to be all you had was full-time workers, but now we're having travel nurses, travel techs at the same time in multiples at facilities around. So it's a growing new dynamic for hospitals in large and small. So it's a really great thing, Jason, to have you here. So thank you so much for that one.
You're welcome. Great to see you.
Thank you. So if you are watching this, I thank you for that. Please do like and subscribe. It's amazing what those little clicks will do for a channel. It's a big help. But if you have any other questions or comments, things that you want to see reviewed or talked about, please leave a message down below. I'll try to read as many as I can. And I look forward to seeing you again on another episode of It's All Interventional.